Hey friends, welcome back in. Well, May is Mental Health Awareness Month, did you know? And Sun Behavioral Health is here for us, and Sun has an intensive outpatient center in Lexington for people who are working to recover from substance use, mental health disorders as well.
And it's estimated that more than 1 in 5 U.S. adults live with mental illness. That's about 59.3 million in 2022. So joining us today is Jason Staats, CEO of Sun Behavioral Health, to talk about how Sun is making a difference for Kentuckians struggling with mental health and why mental health it never takes a summer break, quite honestly. So Jason, thank you so much for coming in today.
Absolutely, happy to be here.
Yeah. So the last time you were in, we were talking about Sun's partnership with Clark. You were starting a new program there with Clark County Public Schools. And you also are partnered with Fayette County Public Schools too. How are those programs going?
Excellent, and it's been a great opportunity to learn and grow what we and understand what kids need, and the partnership's going fantastic, and we probably anticipate more growth in both of those areas.
Yeah, and you know, what exactly is it that you're working with the children on? What are their needs in the school system?
So what we, on our side, we would look at skill deficits, and a lot of those things that keep kids from doing well in the classroom on their own. A lot of times that is either a social skill deficit or some deficit that they have that they need more help with outside of the formal education that the school system would provide.
Yes.
And so we're in there providing coping skills, we're in there providing some day-to-day soft skills that they need that complement what they're lacking to be able to really thrive in the classroom with the teacher.
Okay, well that's excellent.
Yeah.
We need this, but we have a game changer, right? Summer's coming and the kids are back at home. So what can we do as parents to create that positive mentally healthy atmosphere during those summer months?
It's a great question. The kids are without professionals interacting with them as much through the summer. It's less structured, and a lot of times the caregivers, our schedules don't change. Although our kids are having more time at school, more downtime. So we're encouraging parents to have planned events, open dialogue, having meals together so that they're interacting enough to see what's going on with them. A lot of times our kids are experiencing a lot of social interaction through their phone or silently through social media, and we don't always see that on the outside as parents and caregivers. So the more planned interactions, trips together, and more open dialogue that's there to begin with, or in general, we're more likely to have them talking to their parents when something's going bad or negative.
Excellent.
So that's really what we would recommend, is just to really pre-plan and have a lot of those things lined out and in the schedule before you get into the summer.
Yeah.
This is good. Or, you know, we are aware of it and we're not quite sure what to do with that. We're coming
parents,
and going.
yeah.
We're like, well, we're keeping the roof over the head, and not quite sure what that next step is, but finding ways to stay engaged, it sounds like.
Yep, and you're not alone.
Yeah.
Parents aren't alone. There are professionals. We exist over the summer. We do have some programs in the schools. However, our services are available 24/7. We have a counselor that would be able to either virtually, on the phone, or in person meet with someone, help a family through the crisis. So feel free to reach out to us for that.
So how is this funded? Is it through insurance? Is it through the state? How does this work?
For our services, they meet medical criteria, and a lot of patients have a third-party insurance that helps with the payment of that. So we bill and manage that funding through the insurance payment for their services.
Great. And where do people find out more information about your program as well?
Both campuses, all of our services can be reached through sunkentucky.com, and we have virtual assessors. We have phone contacts that you can make to us on the website, but that's probably a good place to start.
Okay.
That's excellent.
Yeah.
Good to have someone riding along this journey with us here. We need it. And not just the environment changing, but the kids are growing so fast and changing so fast too. I mean, our teenager, it's like day to day, I'm like, wow, when did we start this? So
Right.
good to know that we've got you. That website one more time for
sunkentucky.com.
sunkentucky.com.
All right.
We appreciate it. Thank you so much.
Thanks for coming in.
Thank you.
Back after this, friends. Stay with us.